Welcome back. The number of Aussies aged under 45 being diagnosed with cancer of the tongue has absolutely skyrocketed. Young women have had the biggest increase, with cases soaring, get this, 385% over the past 30 years. But what many people may not know is that the human papillomavirus, the same virus that causes cervical cancer, is the most common cause of tonsil and tongue-based cancer. And early diagnosis will make all the difference. So the best thing that people can do is be aware of the symptoms, and that is what this segment is all about. For more, we're joined now by Associate Professor Bruce Ashford, who's a surgeon and Director of Head and Neck Cancer Australia. Good morning to you. Thanks for being with us. Those statistics are just extraordinary. What's behind that enormous surge?
Well, we don't know. It's an area where we're doing a lot of research at the moment, but certainly once upon a time we used to think of tongue cancer as being a disease of old men like me who smoke and drink and misbehave. But truthfully, we found that the paradigm of head and neck cancer has changed a lot over the last few years. And certainly we're seeing recently an increase in tongue cancer in young women. And tongue cancer is a really serious problem, affects every part of your life and really sets you up for a life where you have to overcome many disadvantages. And as you said in the introduction, the early detection is the only way that you have any idea. So that's the role of GPs and dentists is really important for anybody who has an ulcer that doesn't heal in their mouth or a lump in the neck that they can't explain.
Okay, some of the other symptoms I saw is a sore throat. I assume a sore throat that doesn't go away. Over what sort of period of time? And any of the other symptoms we should be aware of?
So a sore throat that doesn't go away after 2 to 3 weeks is certainly something that your doctor needs to know about. And associated with that, sometimes you can get pain in the ear as well, which you can't explain and isn't related to anything going on in your ear. And obviously a lump in the neck is concerned. You know, there's no reason why anyone should have a lump in the neck. And if you have a lump in the neck, it's really a matter of getting along to your doctor, getting them to have a look, perhaps some type of imaging, an ultrasound or a biopsy. But these are the sort of symptoms that really just can't be ignored. And unfortunately, during COVID, there's been a lot of ignoring of chronic or emerging medical problems, and it's just a major risk, particularly in groups where we wouldn't have once expected it.
Yeah, yes indeed. Look, we know that the human papillomavirus, which is the same virus that causes cervical cancer, is also behind a lot of throat and neck cancers. Of course, we're vaccinating against HPV for cervical cancer. Now, is that something that we can do for throat and neck cancers?
Well, we hope that some of that will pass on, some of that immunity will pass on to people as they go through, but there's a lot of the population in their 30s, 40s, 50s and 60s now who are developing HPV-associated neck cancer. These are usually people who've never smoked in their life. They're developing base of tongue or throat cancer as a result of HPV. A lot of those people aren't vaccinated. So we're hoping that that particular type of throat cancer will reduce over time. But at the moment, we're sort of in a tsunami of HPV-related head and neck cancer, and something that not everyone in the community understands. And they're people who have lived what they would think is a really clean life are really blown away by the fact that they developed a cancer in their throat.
And this is why you are desperate to just raise awareness of this, so people are actually thinking about it. Just to finish, what is your message to people about throat and neck cancer?
Well, the message is not to ignore things. Message is to get to your doctor or your dentist if you've got any of the symptoms we've talked about, to go on to our website, Head and Neck Cancer Australia. It's just an information site for people with head and neck cancer. Join up for our ride next year, Ride Beyond 5, to raise money for head and neck cancer awareness. And we just want people to just be aware of things, not get distracted by COVID, and to keep in touch with their dentist and their doctor if they've got any symptoms at all.
Well, such an important message, and brought to us from Stanwell Park, I reckon one of the best locations we're going to see this morning.
Fantastic.
Terrific stuff. All right, Associate Professor Bruce, thanks so much for being with us. Here's Michael.